2 broken teeth and no way to fix them. Carol Goulding from Friskney near Skegness is among the thousands who can't find a dentist who'll treat them on the NHS. As a volunteer worker and carer, Carol can't afford the £1,000 it would cost to go private. Instead, she's using turmeric and painkillers.
It's a bit of relief, and then if I eat something it starts again, and then of course the turmeric, when I had a really bad infection towards the back of my tooth and my jaw, I knew it should have had antibiotics, but I couldn't get a doctor's appointment either.
BBC researchers have contacted thousands of dentists across Yorkshire and Lincolnshire. Of those that responded, almost all were not accepting new adult patients, and fewer than 1 in 5 were taking on children. And for those with a waiting list, between 14 and 29% said it was a year or longer. At Perfect 32 dental practice in Beverley, more than 400 people are on the waiting list for NHS care. And the reason, most dentists say, is the contract they have with the NHS, which they say doesn't always cover the costs of treatment.
If the patient needs 1 filling or they need 10 fillings, the practice and the dentist get paid the same amount. And this is why a lot of dentists saying they'd rather work in a private setting. The patients who need the help the most, the ones who perhaps can't afford the private dental care, they're the ones that are suffering.
The NHS says it recently announced the first dentistry reforms since 2006, and that high-performing practices will be given the opportunity to increase their activity and treat more patients. It says discussions around further changes that benefit patients and staff are still ongoing. But for now, the phones keep ringing with patients searching for NHS care. Anne-Marie Tasker, BBC Look North.